So, what are some of the coping strategies for the hospital-based frontline healthcare worker during COVID-19? Well, it's recognizing that not only what we've talked about is this is a very stressful experience, but it can also be very rewarding. I think that we see that with regards to communities acknowledging the impact of frontline healthcare workers, that there is an appreciation. And that can sometimes get lost, forgotten, not acknowledged, and that all we focus on is the stress, the negative aspect. But one way to cope with it is find something each day that has a rewarding aspect of the stressful time that you went through. Another way to cope with coping with the stress is that recognizing that this fear, this anxiety, and again, fear and anxiety are an anticipation of the future. It's actually expected. It's something that's unavoidable. So if we expect ourselves to have this increased level of anticipation that causes us to worry and have fear and have anxiety, then we don't become anxious about feeling anxious or fearful of living in fear. But what we've really learned is managing stress is essential during a pandemic to large scale, long duration events. And that what we do know is that there are effective coping strategies that can be used both before, during, and after a pandemic. And for those that we work with in a healthcare setting, we actually call this pre-incident education, teaching people the unique stresses associated with their job, anticipating the stress will occur, and teaching people what they need to do to recognize the signs and symptoms, what they can do to mitigate the stress reaction, and then what they can do after the stress is over to continue their health. So we know that coping with the stress really is about three words. It's about building your resistance. It's about developing your resiliency. And it's about being able to plan your recovery. So what do we do? Well, we really want to deploy these preventative measures. So I would ask each person watching this to do an inventory of how do you know that stress shows up in your body and in your life? How does your body tell you that it's not coping well with the stress? And then what do you do? What have you done in the past that's worked to reduce the stress? And do them. Maybe you can't do it to the same degree that you once did when maybe the gym was open or when it was free to walk in a crowd or maybe go out for dinner with friends or visit family, but adapt it to work, be innovative, be pragmatic. We know that there's a large body of research on grounding techniques, being able to just breathe, being able to just sort of feel the moment without anticipating the future. We call that mindfulness. There's a lot of different resources and apps that people can use to practice and learn mindfulness. But what we also know is that education, learning about stress, learning about yourself, learning about that it's okay to not be okay and that you're having a normal reaction to what is an abnormal situation can often do a lot to help reduce that stress. So educate yourself. And in the moment, it's really knowing, what do I need? Are there places that I can call? Are there people that I can talk to? Are there peers that will understand? And if I need more, where do I go to get more, whether it be formal counseling or formal treatment? But it's knowing prior to the impact where you would feel comfortable going or what is accessible to you. And for everybody that works in a healthcare setting, there are some supports and services, everything from your employee and assistance, your EAP, your employee assistance program, to many organizations have peer support and crisis intervention on site or available. And then also, do you have any resources that if you need more that you can access for maybe counseling or more formal treatment? Family doctors, community treatment centers, family, friends, people that you trust might be able to give you some guidance as to where you can access some supports and services. So here's some things to remember during this time of responding to the threat of COVID-19. We want to acknowledge that what is going on is having an impact, and we want to be able to understand the nature of that impact, not only on ourselves, but those around us. If we want to say, this isn't impacting me, it hasn't changed me or those around me, there might be sort of a disconnect between your experience and the reality. So acknowledging as a first step the nature and magnitude that this pandemic is having on you and those around you, just doing that bit of an inventory. Be prepared to be impacted not only in your professional role, but in your personal life as well. Don't let it sneak up on you and be surprised by it. Again, just reflect back on, say, how is this changing what I do, how I do it, both professionally and personally? And then we know that stress actually affects us in 5 really predictable areas. So first of all, there's physical signs that stress is impacting us. It might be from everything from increased blood pressure, muscle tone, or muscle aches, headaches, upset stomach. From an emotional point of view as well, most commonly, maybe our fuse is shorter, maybe we're more tearful, maybe more feelings of guilt or sadness. From a cognitive level, it changes the way we think. It's harder to plan, it's harder to think, calculate, problem solve, really make sense of things at times. And then what happens is we start to see behaviors change to cope, where maybe what we do is we might increase our sort of physical exercise, or maybe what we do is increase our numbing, our zoning out. Maybe that's the use of alcohol, medications, internet, zoning out in front of the 24-hour news cycle. But what we do in response behaviorally is really going to impact whether or not those other signs and symptoms of stress go up or go down. So it's being able to make sure that what you do is adaptive and healthy for you. We also want to encourage people in healthcare. I know it's often hard when there's a job left undone, when there's patients yet to be seen, when there are people suffering or in need. It is hard to put your needs ahead of theirs. But remember that a sprinter that runs a marathon often doesn't complete the run. But a marathon that runs a sprint also has a difficult time too. So we want to make sure that our healthcare workers take time to respond to their needs and the needs of their family, as well as those needs of patients in the organization that they work for. And it might be a good time before you recognize or even are significantly impacted to make a list of the personal care activities that you enjoy. So all you need to do is find that sticker on the fridge or on the mirror, rather than trying to recreate or think about what you would normally do to engage in self-care. We know that being active, just getting your body in motion for about 25 minutes can burn off the stress. We know that distracting with a book or some sort of distraction with a movie can really be helpful to just turn off the mind. And we are social animals. And what I said before was that social isolation has such a dramatic and negative effect on us, because we really are creatures of being together in a social setting and staying connected. That it's important that best we can to ensure that we don't break those connections, that we keep them going. And what we want to do also is take a break from the media coverage, including social media. Our brain really has this habit of, every time it sees a news story, it thinks of it as a unique and novel event. Whether you're watching repetitive news cycles on TV or reading social media, that your brain can't distinguish between one event and the repetition of the same event, and it becomes cumulative. So if you're reading 5 news stories on the same event, your brain thinks of that as being 5 distinct events, and it can have that cumulative effect on you. So take a break from the news coverage, take a break from social media. You're not going to miss anything that you can't pick up when you're ready to check in for a limited amount of time. And most importantly, if you're feeling overwhelmed, ask for help. Go to your go-tos, go to your supports. It's not a failure. After all, in healthcare, when people show up asking for your aid as a professional, you don't think that they're weak. So if you're asking for help, nobody's going to think that you're weak. They're going to acknowledge that you're having a normal reaction to this abnormal situation, and that feeling overwhelmed is to be expected, not to be avoided. So we are in this for the long haul. How do you do that? Train hard, know your job. Make sure that you routinely participate in getting your body used to those changes in how you perform, those simulations. So practice your skills. Do those things that don't come routinely over and over again, so they become a little bit more routine. And for those of you that work in a situation where you might need to self-isolate due to exposure, make sure that you have a to-go kit. Make sure that you have something that has at least enough to carry you through until people can bring you more. So we encourage people to have a to-go kit that allows them to, if overtime is needed, to be able to stay, but have what they need to get through. If you do need to isolate, that you're not left without what you need. And if you're called to other departments or units for relief, you have that ability to sort of refresh yourself, look after your basic needs in order to meet those demands. We know that reviewing policies and SOPs is a good thing, but not obsessively reviewing them and over inundating yourself. Get updates as things change daily, but limit that sort of constant flow of information from the minute to the hour to hour. Not much changes in a couple of minutes or couple of hours. We encourage people to check at routine times when it's convenient for them and update yourself daily. Make sure that you take that time, that ability to sort of slow down, clear thinking, be prepared. That will make you a valuable team member and decrease your risk of harm. And remember that to be disaster ready means keeping in good physical shape, eating healthy, and practice emotional grounding. I said to you before, those that recognize their personal signs of stress and what's causing their stress can often react to it and reduce it far quicker than trying to figure it out in the middle of it. Create a buddy system, somebody that you know, maybe somebody that you both know each other that can recognize the signs and symptoms and encourage you to get exercise, relax, or even talk. And take time to disengage from those operations. What you need to do is work. It's important that you take time away and do those other things. Find constructive ways to relieve your stress. If the gym isn't open and you're normally an active person, find an app, go for a walk your stairs in your house, do something. And do activities that you can do safely alone, such as taking deep breaths, reading, listening to music, going for a walk, stretching, meditating. Keep it simple. Just a few minutes a day can make a huge difference. And here's what we do know, that 22 minutes of your body in an active cycle can help you get more restorative sleep than if you just go to sleep stressed. So here are some of the common signs that stress may not be managed effectively. So sadness and empathy, guilt or shame, shortened fuse, blaming yourself or others, and just a sense of being irritable. The alternate is sort of this emotional numbness or indifferent, almost like you can't care anymore and you have to shut it off, like the emotional breaker. That you're not really paying attention to your self-care because you're so focused on everybody else, and that you just can't get enough rest where you can wake up feeling refreshed. There's constantly feeling tired, exhausted, overwhelmed, maybe even feeling like you're a failure or helpless, or that you're not performing. And then you start to sort of rely on things to sort of shut off, numb, or to cope, like drinking more than you normally would, or taking something to numb yourself. this excessive worrying, that fear that something bad is going to happen is sort of a good indicator that you're signs of a psychological impact, that if you're easily startled or on guard, if you have a racing heart, recurrent thoughts or nightmares, or really focusing on other people's difficult or traumatic situations as if they're your own, those might be signs that you're impacted, and increasing the self-care, reaching out to your resources would be indicated. And as much as we are socially distancing, we still come in contact with people, and stress and psychological impact impacts our interpersonal relationships. So we see irritability, anger, hostility, this need to blame, this decreased ability to support our team members, more conflict with peers or family, this sense of withdrawal, and this increased sense of isolation from our family, our coworkers, are also important signs to recognize. So what are some of the self-care techniques? It's okay to set your limits. Know what's healthy for overtime and extra duties. Be okay with saying no at times. Doesn't mean you'll say no every time. And work in teams. Limit the amount that you work alone. Just keeping track of what your thoughts are, what your impacts are, by maybe putting down a few words in a piece of paper. And most importantly, talk, access your friends, your family, supervisors, your other team members who are also impacted. After all, those are in it with you, understand it from a different perspective, and more likely to help you through it. Breathing, relaxing, maintaining a healthy diet, sleep and exercise are important, and setting really good, healthy boundaries, being able to say no. And most importantly, be okay with not being okay at times, and avoid the attitude of suck it up and to do more. So especially for healthcare, especially for frontline workers, it's important that it is not selfish to take a break, that the general public needs are not more important than your own needs and well-being. And working all the time does not mean you will make your best contribution. There's other people who can help. Let them. Knowing and recognizing the signs of stress in yourself and others will help you cope more effectively and help those who are also affected. So when to seek help? Well, what we've talked about are some normal reactions. That usually engaging in some self-care is enough to help bring those reactions down and return back to a level of functioning. But on this slide here, we have some of the reactions that we would really encourage that if you are experiencing them or seeing them in other people, that they do require more professional attention. Sense of disorientation, prolonged and intense sadness, thoughts of hurting yourself or others, this unrelenting anxiety just never goes away, this constant fear of waiting for the other shoe to drop or that something bad's going to happen. And these unusual perceptions, these acute symptoms of hearing voices, seeing things, or delusional thinking, the inability to care for oneself. And that if you just notice that your use of drugs, alcohol, or prescription medication are just not your norm, they're beyond your baseline, those are indications that you might want to reach out for some professional help. And anything else that is either impulsive or uncharacteristic for you, talk to somebody. These are signs that stress might be overwhelming you, and that with some professional attention, you can really quickly return back to your level of functioning. We've talked about the negative aspects of stress, and I don't want to leave this section until we talk about the signs of positive stress, positive change, post-traumatic growth. Through difficult times, we can grow. Most of us do. And some of the things that we might have taken for granted, we might be actually more appreciative now. That we have become more understanding and tolerant. Things that might have annoyed us are less bothersome. and that we might appreciate the relationships that we have, the staying connected now that those connections have been disrupted. And maybe there's a sense of gratitude or being grateful for what we have, or this improved perspective. Maybe what happens is, as we go through difficult times, our connection to others and the greater good has a sort of feel, a renewed sense of sort of greater connection. Whether you call that spirituality, existential, it doesn't matter, but it's a feeling that we are something larger than just ourselves, and that we're interconnected. Those are signs of positive growth, and most people experience them. So any questions or comments on this section that we just presented on?
Jeff, the one question I have is when I'm looking at this for myself and kind of monitoring my own self, but is there any good techniques for monitoring our colleagues? In the work environment, everybody has different coping strategies, different life experience outside of work. Is there anything that we can look at for some things that maybe we need to reach out to some of our colleagues to get some help during this?
Yeah, I think first of all, I think it's creating a culture and an atmosphere that if you're offering help, that you're also willing to receive the help. So I think it's that not having a double standard, first of all. It has to be safe for people to acknowledge their impact. So it's creating that sense of safety that it's okay to say, I'm not okay. And then most importantly, and this is where your peers, the people that you work with are really, and the people that you live with by that matter, really understand what your baseline is. And it's being able to have a caring conversation when there is a change from your coworker's baseline, and doing it in a constructive way rather than a critical way. Being able to start the question start the conversation with, I just notice that you're not yourself. And then being able to identify, do you know what to do about it? Do you have the supports? Do you need something more, in a caring way? And it's interesting that being in a caring profession, sometimes the people that we ignore the most are the people that are standing next to us in the roles that we do. So I would say extend that caring to those that you work with in that neutral, non-judgmental, helpful, constructive way that you would with a patient. I think that also being able to give people, and I know that on some of the different hospital-based teams, we don't want to anticipate that people are going to struggle, but what we want to do is acknowledge that people will struggle and that that's okay. And I go back to my favorite saying, which is letting people know that it's okay to not be okay, that it's not a personal weakness, and that you're willing to have the conversation. Any other questions or comments?
Yeah, Jeff, I think even for myself, like when you, like, as you did that part of the presentation, it was really good reminders, even for just myself, thinking about like my own stresses that I have in my new position and whatnot, and thinking about taking that time to make sure that I set that time in my calendar to like exercise, if that's like what I do to de-stress if I had a really bad day. And I think that's really important, even when I think about like my staff that I look after now, just making sure that like they're getting their breaks. If they're not, like maybe those are things that even I have to look out for them, to make sure that we give them that chance just to step back a bit.
Yeah, recognizing, we often say that the best place to start in supporting people is recognizing their basic needs. The need for a biological break, either to put nutrition in or to go to the bathroom, to be able to step away and let people know that it's okay to step away so that they can step back into it. So I like to sort of say meet basic needs as a place that you can start in the workplace. If you notice that somebody hasn't had a chance to take a break, recognize that. Even if you can't cover them to give them a break, sometimes just that acknowledgement is enough to help them say, well, somebody's paying attention and notices that it's a stressful time or a long duration. We know that social support really plays a role. And it doesn't necessarily mean that we need to help somebody through a stressful time. Sometimes all it means is that there is an acknowledgement that there is a stress going on, even if there isn't anything that we can do about it. And that way we can feel one with the experience rather than alone in the experience. And that has a huge restorative and protective factor.
And even Jeff, when you're talking about even like duration, like I think about even how COVID-19 has affected how we even like run code scenarios and whatnot. Like they're trying to limit the number of people that are in there. So it might just be like one physician, one nurse, one RT. And like those people are in there taking care of that patient versus somebody else might be on the outside helping, and their involvement is a lot more than and not being able to like say get that help, somebody switching quickly. Like we want to decrease the risk of exposure of the numbers of healthcare workers that are in that room.
I agree, and I think just acknowledging that it's an imperfect situation right now, that you're all in together, whether you're in the room or outside the room, in itself is a form of support.
I'm going to jump right to that growth part of the section here. It's been really cool to see how fast we've been able to push through certain innovations that have been on our back burner for a very long time. So I won't get into specifics, but I will say that I'm really happy, and it's energizing to see some of the gains that we can see and hope that we will continue to see through this pandemic. And then another win, I guess, is, as Leanne was saying, instead of your scope of control being at the patient family unit level, we have had to, bridge the silos and talk to various different units and departments. And with the potential for redeployment, we're really working on strategies to be able to build relationships between management, build trust between management. This idea that we're not just looking out for our own units, we're looking out for the site as a whole, and then to start having that filter down to staff relationships. And so what does that look like when we're facilitating shadow shifts or buddy shifts, and making sure that the expectation is clear, and that we're offering tools for communication so that we're setting up these relationships for patient care in a way that's successful for everyone. And so there's some really cool potential with what we're doing in that realm of things.
And I think that, again, that post-traumatic growth it's finding the silver lining in the gray cloud. It's really looking for some of the positive. Stress has this aspect on all of us that tends to have us focus on the negative. It's called the negative brain bias. And that when stressful times go up, we perceive there to be a threat. So we look to confirm that, which is usually the negativity. And sometimes the most constructive things we can do is ask ourselves, how might there be a positive out of this? How might this adverse situation that we're going through have a positive effect? And it doesn't have to be big wins. It can just be little ones, because again, the negative brain bias skews your brain to perceive things more negatively than they are. And to bring balance back simply says to find something small so that it sort of tips that scale back to be more accurate. As difficult as the situation is that we're all going through, it is worldwide. The other thing is there are positive things that the changes in how we function are having on some people, and the negative as well. So balanced thinking is key during this time. Really, really fight that urge to focus on that negative and feed into that negative brain bias. Some of the people that I work with that are really struggling with the negativity, I ask them to write down 3 things that they're either grateful for or that were positive from the day before they go to sleep. Now, after a couple of days, what they say, it's harder and harder. And they say, so I had to create them. So I wanted to write 3 things down, so I made sure that I caused them to happen. And everybody has that power that within the challenges of the day, they do have that ability to make one small positive thing, a medium positive thing, or sometimes even a large positive thing happen. So we can control certain things, even in a world that seems out of control. We can control what positivity we bring to it, either in our actions and our thinking. And it really has helped a lot of people get through what is perceived as being an overwhelmingly negative time.